Okay. All right, you're live.
Hi, good afternoon, everyone. My name is Paul Casey. I'm the Chief Medical Officer at Rush, and we wanted to take a few minutes of your time to really talk through some of the common questions that have come up in relation to the COVID vaccine. I know a lot has been changing, and it's been changing quickly, not just in terms of the vaccine distribution and the information about the vaccine, but even with the change in administration, I think we're going to see more changes ahead in terms of vaccine distribution strategies and when we may be able to see additional vaccine as well. So I'll start with some of the common questions that we've been getting here at Rush, and then certainly if there's additional questions you'd like to put in, we'll try to get to those as well. I think probably the most common question is, when will I be able to get the COVID vaccine? And it's a complicated question, actually. We are aligning with, being in the city of Chicago, here at Rush University Medical Center, we are aligning with the Chicago Department of Public Health's guidance around this. Okay. The Illinois Department of Public Health has similar guidance that really most of the departments of public health throughout the state are aligning with as well. We are, as of next Monday, entering phase 1B. So maybe I'll tell you first about the work that we've done through phase 1A, and then tell you a little bit about what that means when we move into phase 1B. So starting about mid-December, December 17th, that's when we first got the approval of two different vaccines, the Pfizer and the Moderna vaccine that you've heard about. They're both very similar in terms of their characteristics, in terms of how effective they are, even in the type of vaccine that they are and how they work with your body to create this immune response as well. So since that time of approval, soon thereafter, we began vaccinating that phase 1A, which was our healthcare providers. And we're fortunate in that we really were able to ramp up a significant amount of vaccinations here through our vaccine clinic. And at this point, we've already vaccinated about 80% of our healthcare providers throughout the Rush system. So we are in good shape from that perspective, and we are now prepared to move into phase 1B, understanding that while we move into phase 1B, we will continue to vaccinate any other healthcare providers that are out there. And it has not just been the Rush healthcare providers that we've been vaccinating. We have also been collaborating with the Chicago Department of Public Health to reach out to those communities that have been most disproportionately impacted by COVID vaccine and identify healthcare providers there not affiliated with health systems, hospitals, or universities, and we've also been vaccinating people from those communities. So really made a great start into 1A, and I think certainly the time to be able to expand this more broadly. So starting next Monday, we're going to begin moving into phase 1B of vaccination. And that is the group for those that are over 65 years old and frontline essential workers. There's clearer guidance on exactly who's included in frontline essential workers, available both on our Rush website that I'll point to later, as well as Chicago Department of Public Health, Illinois Department of Public Health. But essentially, that is those over 65, as well as those that are really interfacing with public on a daily basis. So it includes our postal workers, it includes our grocery store workers, it includes those that are involved in public transportation. And we anticipate, as we kick this off, that it is going to take a couple of months to get all those groups vaccinated. And we'll be participating at that, certainly here at Rush, beginning with our patients that are over age 65, as well as those that fall into these other categories, as well as offering out to the broader community those that would like to get vaccinated here at Rush. So Chicago Department of Public Health anticipates that will take us through the end of March, which may be a bit optimistic because a lot of this is really dependent on the supply of vaccine that we have into Chicago. So I'd anticipate end of March, probably into April, as we continue to vaccinate our communities with the overarching goal to get to that 80% herd immunity, getting 80% of each of these groups vaccinated to really start building up our community herd immunity to the virus. Thereafter, so mid-April, May, again, depending on vaccine supply and how effectively we're able to get out and vaccinate these communities as an entire state and city, we will move on to 1C. And phase 1C is those that are 16 to 65 years old with a medical condition. So it is really quite comprehensive in terms of what a medical condition is considered, and that will probably be an even larger group as we continue to phase out, we anticipate. Again, there we'll be vaccinating both our patients here at Rush, as well as those that are interested in getting the vaccination at Rush. And beyond that, the timeline is really too unclear at this point to really commit to a date or a time that we'll be able to move into phase 2, which is that general population. That does not include, and importantly, does not include pediatrics at this point. The Pfizer and Moderna vaccine are approved for those over 16 years old and those over 18 years old, respectively. There's ongoing studies in pediatrics on the safety for these vaccines in pediatric patients. So we hope to have more data going forward, and optimistic that we can get that data and begin later this year with vaccination of our pediatric populations as well. So I'll move on to the second question, which is what's Russia's vaccine distribution plan? And really what we're focused on is making sure that we get the vaccine delivered as effectively as possible, as quickly as possible, and certainly with a lens on equity. We want to make sure that we are getting into the communities that have been most disproportionately impacted by COVID, because that's truly where additional lives will be saved by preventing further clusters of infection in some of those communities. So our vaccination strategy is really multi-pronged. Some of it is sessions like today, the education piece. We have already vaccinated over 17,000 individuals here at the Rush University Medical Center, just over the first month or so that we've had this vaccine deployed, as well as at our other hospitals at Rush Oak Park Hospital and Rush Copley Hospital. We've had additional vaccination sites there as well. So we are following and closely aligning with the city's guidance. We are on daily calls nearly with the city to make sure that we're completely aligned with their phasing as we push this out. So we'll continue to push it out both to our patients and to other members of the community, both for those that want to get vaccination here at Rush, as well as taking the vaccination out to communities and partnering with the city to be able to do that, to make sure, again, that equity is really our driving principle on how this vaccine is deployed. So the next question we had was, what if I have pre-existing conditions? If I'm on immune suppressants, if I'm on chemotherapy or dialysis? And the answer to that is really the distinction between that phase 1B and the phase 1C groups. So those over 65 with any condition, or those over 65 at all, will be in phase 1B, the vaccinations that we're starting on Monday. Those that are between 16 and 65 with a medical condition, that will be the next group that we'll get to once the phase 1B vaccinations are complete. So again, we anticipate that being in the April, May, June timeframe that we'll be rolling out vaccinations to those groups. Another common question we've had is, what side effects should I expect from the vaccine? And this is an important question, and something certainly we've learned with our experience of over 17,000 individuals vaccinated. The most important message is that we have not seen serious side effects from the vaccine, meaning any of those anaphylaxis or severe allergic reactions. We've seen only a few individuals that have developed a rash or developed, not felt well, requiring going to the emergency department for any sort of evaluation, but again, not a severe allergic reaction. The more common side effects that we see after vaccination are fatigue, chills, muscle aches, and most commonly is actually just some soreness around the site of vaccination, very similar to what you experience with a flu vaccine. Those should not be confused with side effects from the vaccine. Those are actually evidence that your immune system is responding to the vaccine and creating those antibodies that are important to protect you from the COVID virus. So important to make that distinction between the severe allergic reactions, of which there are nearly none, and those that are the common side effects that we anticipate after someone gets the vaccine. I can tell you personally that after getting the vaccine, the first dose, the most common side effect was just a little soreness around the arm that lasted a day or so. The second dose, people tend to have more of those side effects of the fatigue, the muscle aches, the headaches for about 24 to 48 hours after the vaccination. It's actually more pronounced in younger individuals, and in older individuals generally tolerate it better. And again, that's the evidence of that immune response, really in your body's response to the vaccine being more pronounced in the younger population. So incredibly safe and effective vaccine, both the Pfizer and the Moderna vaccine, which is great news. This is something that we didn't necessarily anticipate, having two great vaccines this early on, looking back 6 months or so. So moving on to the next question, is around pregnancy and nursing moms. So this question also comes up commonly. And the honest answer is that within the trials that validated the use of this vaccine, pregnant and nursing moms were not included necessarily as a group in this trial. Now, that being said, the American College of Obstetrics and Gynecology, which is kind of the academic body over OB, obstetricians, and those interfacing with pregnant moms, have said that it is likely safe and effective in those populations. The recommendation is to talk to your OB-GYN regarding this, but that American College of Gynecology is still recommending the COVID vaccine, because really, again, with all of these things, we're looking at the risks versus the benefits. And the feeling is that the benefits of getting the vaccine and protection for both the pregnant mom as well as their fetus far outweigh the risks of someone getting the COVID-19 virus and some of the complications and sequelae that can come with that virus. So, moving on. Should I get vaccine if I've had COVID-19? This is another common question that comes up, and the answer is yes. So what we don't know is after someone gets COVID is if they continue to have protection or continue to have some of those same antibodies and how long that protection lasts. We do know with the vaccine, you're sure to have that about 95% efficacy against against developing the COVID virus again or having severe complications of COVID if one gets the virus. So again, the recommendation, even if you've had COVID before, is to go ahead and get the vaccination. All right. And how soon does it start working? Another great question that we've had. And the answer is really based off what the study showed us. And a lot of this depends just on how the study was designed and when they looked to see if the vaccine was effective. So in the case of the Pfizer vaccine, you get your first dose, and then 21 days later, you get your second dose. In that study, they looked a week later to see what the effectiveness of the vaccine was, and at 1 week later, it was 95%. So we know for sure that a week after that second dose, your protection's 95%. It may even be a few days earlier, or we don't quite know. That's just exactly what the study showed us. In the case of Moderna, you get your first dose and you get your second dose 28 days later. So that's one of the key differences, is that 3 versus 4 week difference. And they looked at 14 days after that second dose and saw that the vaccine was 94.1% effective at that point. So the short answer is 7 to 14 days, a week or two after your second dose, we know that the protection is outstanding in terms of developing COVID infection or any of the severe complications that we've seen from this disease. So can I change my behavior after getting vaccinated? And that's, the travel, gym, things like that. Some of the data is still being developed in terms of knowing if we can, after getting vaccinated, although we are unlikely to develop COVID or get the symptoms of COVID or any of the severe complications of COVID, what's not known is can you still carry COVID and pass it on to other people? So we need to continue the behaviors of masking, social distancing, those things to which we've become acquainted or accustomed. We need to continue that behavior even after vaccination. Now the hope is that we begin down the road, once we hit that herd immunity or 80% of our community is vaccinated, that we're able to start relaxing some of those things. We're able to get back to hanging out with people and being able to give hugs instead of wearing masks and staying distance all the time. So that is in our future. So one other question that did come in just through our time now is, how can I get the vaccine at Rush if I don't have a doctor there? And that's a great question. So there's going to be more announced on this early next week. We are standing up an interface with the Chicago Department of Public Health, and that will allow you to schedule a vaccination through Rush using kind of their platform that they're developing. You can always call Rush and ask as well if you're interested in getting your vaccine here at Rush, and we can point you to the right resources. There's also a website that we want to make sure you're aware of. It's rush.edu/vaccine. And that website has a lot more information on how you can come here to get vaccinated at Rush. Just keeping in mind that it needs to be at the appropriate time. So when we're in this phase 1B, again, those over 65 and frontline workers, we can't get you the vaccine if you don't fall into that group at this point. So another question that came in, will essential workers need letters from employees to get vaccination as part of 1B? And that's a great question. We are actually awaiting some further guidance from the Chicago Department of Public Health on this specific issue, that I think more of this guidance will come on Monday. Our philosophy has been that the more vaccine that we can get into arms and out of sitting in bottles, at the factory, that's really what's going to get us toward the end of this journey and the end of our pandemic. So we want to be able to vaccinate as many people as quickly as possible. So with that, we're going to sign off. Thanks again for taking the time to tune in this afternoon. And just a reminder, that website for more information is rush.edu/vaccine. Thanks again.